I think it's time to get started. Let me welcome everybody and thank you for joining us. I'm Cliff Lynch, the director of CNI, and you found your way to one of the project briefings for our Spring 2020 virtual member meeting. I want to note that this is one of a small number of additional project briefings which we added after we made the decision to move to a virtual meeting. And we called for and selected a small group of additional project briefings that were specifically addressing aspects of the current crisis. We'll have two talks today, one by Lisa Hinchliffe and the other by Christine Wolff-Eisenberg. After we hear from the two of them, we will take questions. There's a Q&A button at the bottom of your screen, and feel free to queue up questions at any point as they occur to you during the presentation. Diane Goldenberg-Hart from CNI will pop back up at the end of the session and will moderate the Q&A. And with that, I'm really looking forward to hearing about this. We were joking just before we started that back in the old days, you don't spin up a large-scale project like this in 0 time typically, and welcome to the new normal. I'm also really fascinated to hear this because I've had a relatively close-up view of some of the attempt to understand this response specifically within the ARL community, which is actually a very small and very special community within a much broader universe of academic libraries. And I'm really interested to hear what our speakers have learned about the map of that broader response. So with that, thank you all for joining us. A very special thanks to Lisa and Christine for being willing to not only spin up a project like this in no time, but to report on it in almost no time as well. Over to you, Lisa.
Great, and thank you, Cliff, and thanks to everyone who's joining us here today. It's unusual, as Cliff said, that we would be spinning up a project, much less be presenting on it, but I think this is the CNI way, right? That what we value especially about CNI is our cutting edge, often view of these things. So we're cutting edge for sure these days. The presentation today is about our project, which is Academic Library Response to COVID-19. And we're particularly going to be focusing on this whole idea of designing and managing real-time data collection and dissemination. Through this project, we have been using the hashtag COVID Library. And so we'd welcome for you to include that hash if you are tweeting about this session, because you will then become part of the Twitter scraping project that is also going on related to this work. Christine is going to be advancing the slides. So I want to also share with you, in case you are a multitasker, the portal for this project is at this convenient URL of tinyurl.com/COVID library, where you can see the breadth and range of activities that we have underway that we'll be reporting on here today. So just a quick overview of this project. It is a real-time view into the evolving strategies that US academic libraries deployed in spring of 2020, which really at this point means in March or April of 2020. And by real time, I want to emphasize that we were collecting responses continuously and still continue to do so via the survey. But not only we were collecting the data in real time, we were disseminating it in real time. And so as soon as the first library submitted data, there was a data dashboard where people could begin to see what the results are. So in addition to this real-time collection on libraries, we've also been collecting data on the status of classes and the status of residents. And at this point, we believe we have the largest data set as well on the status of institutions as far as classes and residential facilities, in addition to library policies and services. We've also done some immediate analysis. So there's disseminating the data on dashboards, there's immediate analysis, and then we'll talk about our long-term analysis as well. So we're going to review, how did we get to this? How do we manage this? Because, you know, Christine's in New Jersey and I'm in Illinois. All the ways we've communicated the results and what we've learned. The impact of this project as best that we can assess so far, and where we see potentially taking it for next steps. So, survey development and deployment. This was a 10-hour development process from idea to collecting our first data. So this is the tweet that started it all, as we say, which was Christine asking if anyone was collecting how academic libraries were responding. Christine had been working with Brian Alexander on a Google Doc spreadsheet that was attempting to capture what institutions were doing as far as classes. And I have no doubt that that's what made her thinking. But we are also starting to see already, within 24 hours of institutions shutting down, that libraries were starting to say, what are you doing? What are you doing? Does anyone know? Right? This is immediately what we want, is information from our community of practice to inform our strategies. So Christine and I got on the phone about 20 minutes later and we started work. So Christine, next slide. We got on the phone and I said, we could do this. And this is the fun part of the story where Christine said, yeah, I think we could have this, you know, in the field, maybe by early next week. And I said, we have to do this today. It has to be out tonight. And, you know, this decision to deploy rapidly has some really important implications for this kind of project. But it was clear to me as a practitioner in academic libraries that 5 days later was going to be 5 days too late. And so we needed to really get going on this. But also, if we were going to collect data, we learned some lessons from other projects that were already spinning up, and honestly, some of them that were crashing. So Brian Alexander's Google Doc. Usually Google Docs are great for crowdsourcing content, not great when thousands of people are trying to use it at once at an immediate point in time. So here's some of the design strategies we had in thinking about what kind of survey data we would be doing, keeping it short and focused. People needed to be able to fill out this survey quickly. Everyone was incredibly busy. I think it's even hard to remember quite how intense and urgent everything felt on March 11th, 12th, and 13th. We also knew we wanted to embed unique identifiers so that data would be collected in a way where we could analyze it. And we all know that if you ask people to put in their institution name, it's amazing how many different versions of a name institutions have. Fortunately, in the United States, we have the IPEDS ID for every institution, and librarians are great about metadata. So we could ask them, please go get your IPEDS ID, put that in. And so we could have a unique identifier in each response set. We knew we wanted fixed answer questions for immediate analysis. So if you really want to disseminate the data back to the field, you need to do it in a way that can be visualized, because once you get over 10 responses, qualitative analysis is no longer on the fly possible in a way that's going to be really helpful. We did, however, give the option of other repeatedly throughout the survey. And of course, those, while then available in text form, were not immediately analyzed onto the charts. We also realized that we wanted to allow retaking. because it was already the case that a decision that was being made on Tuesday, a new decision was being made on Wednesday. And that was part what was stressing Brian's spreadsheet and some of the other pieces, is because they didn't have a way to account for the fact that things were changing. So we accounted for this by saying, you can take the survey as many times as you want. And that's turned out to be really valuable, because it's why we can actually keep the survey open, and we're going to be able to track libraries reopening with the same survey instrument, because we allowed for the retaking. And then, as I said, we wanted to disseminate results immediately. So how did we get there? We had kind of two steps in our process, which was conceptualization and library community input and feedback. So in the process of designing the survey, conveniently, I was supposed to be traveling that day to a conference. And so rather than being on airplanes and in airports, I was consulting with Christine and developing the survey while she would go to meetings. And then between her meetings, we would get back on the phone and confirm that we were ready to take the next step. So obviously, we have general knowledge of core user services and key issues. I work in an academic library. I've worked in one for more than 25 years. Christine leads up the Ithaka S+R surveys work. We know a lot about what goes on in academic libraries, but people have asked us, well, why didn't you cover public libraries and special libraries? And partially it's because the issues are differently, but partially it's also that question of expertise. And we knew what to ask this particular community, and we knew that this community wanted to hear from other people in that academic library community. We did a very rapid literature review where I consulted the literature on library response to crises and disruptions. Fortunately or not, it's actually a relatively small literature. And the other thing I quickly realized is that most of that literature is talking about how you are disrupted in place and you relocate your library. So you have a fire, so then you move the library to the student union, or you have a flood and you only have certain service points open. That is not what we were doing in a pandemic. Everything was closing. So there was no changing the library to another place. And so that impacted our design as well. And then we drafted basic survey questions based on partially the great Ithaka S+R surveys that are out there. So we already knew some of the ways to format these questions. Later that afternoon then, we actually did 2 rounds of feedback from the user community. We first put out a Google Doc with our questions and the responses, with the opportunity for people to be able to comment on it. And we asked them to do self-paced cognitive walkthroughs where they would go through it and see if they could answer it. They could annotate and write us comments in the margins. And then we also asked them to direct message us back on Twitter, is how we were doing most of this work. And then once we programmed it into Qualtrics, which is our platform that we're using, we solicited some pre-testers, and we were gonna have like 2 hours of pre-testing. I tweeted it out, and within 20 minutes, we had twice as many pre-testers as we needed. So I just also think that that tells us the degree to which the community was really hungry for this, because they really helped us do this rapid design process. So at this point, you might be saying, how did you actually pull this together? So let's talk a little bit about managing it collaboratively and what that took. Key practices here: holding regular check-ins. Christine and I were checking in with each other almost continuously, especially the first week of running this. We also had the great fortune that Ithaka S+R was able to spin up a guest account for me on their Slack instance. And so I currently am slacking along with Christine and her colleagues in a special area there so that we could use the same practices that the Ithaka S+R always uses, and could plug me into those. But we also have Twitter and phones. Yeah, we've done a lot of different communication mechanisms. We really had to also be explicit about committing to decisions. So you'd always need to do this when you're developing a project, but we had to really do it fast when you're doing this in 10 hours of development, of have we decided this and are we ready to move on? And being both committing to the decision, but then also moving on from it and not revisiting it. Acting independently became therefore possible because we were so in touch with where we were thinking, what we committed to, that if we through the process got a media interview request or somebody seeking information, in many cases we were either able to consult immediately, or we knew and could be confident that we could act independently of each other in a way that would be in concert with this. We also thought it was really important that throughout this, you'll hear that we incorporated other perspectives. So we got the two sets of feedback from the community. We had, in every case where we wrote an analysis, we were fortunate to have Christine's colleagues at Ithaka S+R provide essentially a quasi peer review for us. Like, does this make sense? Can you understand this? Can you comment on it and help us strengthen our analysis? And then we also just really had to seek the support of each other and others, Ithaka S+R, obviously, but we also had a large group of people on Twitter that helped amplify the call for people to submit responses. And so our willingness to say to other people, we need your help, was a really important part of this as well.
Great, thanks, Lisa. So I think I'm gonna take it over from here for a little while to talk a little bit about both how we communicated the results and actually what the results were. We've been kind of talking about the process. We'll see what some of the outputs were. We'll talk a little bit about how we've tracked the impact, and then we'll talk about next steps, and then we'll open for Q&A. So. As Lisa mentioned, getting the data out there in real time was one of the most important principles of this project. And in a minute or two, I will provide examples of each of these that I'll just talk through really quickly. So we started out initially with just one real-time data dashboard, which I'll show you in a minute, which had results broken out by, here are the institutions that were entering the responses for a first time, and here are the institutions that are entering updates. Started out with just one, and I'll say what happened to that in a second. We published written analyses 24 hours after results were collected, after the next 48 hours after that, and then the 10-day changes that we were able to log from initial entry to an update. And again, to just emphasize really what Lisa said earlier, it was really important that we weren't overwriting the data when an institution gave us an update. We're going to be able to do even more in-depth analysis later on to see how things changed over time, not just in the aggregate, but within individual institutions, and how long it takes to move from step 1 to step 2 to step 3 approximately. We also, as Lisa mentioned, we were frequently tweeting out key findings, key graphs, linking it all to the COVID library hashtag. Spoke with a number of media contacts, the Chronicle, Library Journal, Inside Higher Ed. I think those are the main three. And then, as I mentioned, what started out as one data dashboard grew quite a bit, as you'll see in a second. So there were a number of individual questions that were tweeted out, and organizations that came to us asking, what does this part of the sector look like? Or I wonder what's going on with the libraries that have closed, or just the libraries that are actually still open. And so each time, if it was worth pulling together that dashboard, we not only did it for that individual person, but we also then made it available at this tiny URL so that everyone can now use it. So we're going to go to the tiny URL now. So it's tinyurl.com/COVID library. Hopefully pretty easy to remember here. So just to walk through the web page a little bit here, some basic information about the survey itself. Obviously, a link out to the survey so that people can continue to fill it out, or fill it out perhaps for the first time. So this is how folks can do that. And as Lisa mentioned, it starts out with, please go look up your iPad's code. Please look up your iPad's name. And there's some cleaning of the data that needs to happen later on, but by and large, this has worked actually pretty phenomenally. And so the survey goes from there. We also, in addition to just the link to the survey itself, we have all of these dashboards and results that we've been talking about here. So the first dashboard of all libraries as the surveys are submitted, which is the case for all of these, they're all automatically updated in real time, is here. We'll see what the current total is. Let me minimize my Zoom view. We're up to about 847 institutions represented in the dashboard. That's what we're seeing in the first row here. 590 times there's been an update logged for some of the institutions that have participated in the survey, and this is going to be an outlier that I'll throw out, but some institutions have come back half a dozen times to log updates. Like every time there is some little change in policy or service model, they'll come back, and that's fantastic. I think more so on average, we're seeing more like 1 or 2 updates. But yeah, it'll be so fantastic. We've done some analysis already of the changes over time, but that will be a really, really robust part of the data set to dig into more. And so here we have responses to all of the questions that were in the survey, with the exception of at the end of the survey, we had a kind of a contact section where someone could leave their name, their email address. Really was only for us to be able to follow up to ask them to log an update, but not really for public view. So we've got mostly closed-ended responses, as Lisa mentioned. We also have some open-ended responses here. So we asked a question, for example, about, what's the status of your policy on employees working remotely? We have a follow-up question about how that policy affects different employee groups. We also have an open-ended question asking folks to link out to websites where they might have information for library users on policies and procedures. And so this is all available here, and this represents all of the institutions in the data set. And then, of course, we have a number of dashboards that are for parts of the data set. So we have libraries at non-residential institutions, which for our purposes is meant to be kind of a proxy for community colleges. It's not a perfect one-to-one match, but quite close, actually. We have dashboards for ARL institutions in the US, HathiTrust academic library members in the US, and then a number of other dashboards that are based on the status of libraries being open or closed in terms of their buildings, and then a subset of that for ARL institutions as well. I'll just highlight a couple of other things on this page. So Lisa and I were frequently for a while there tweeting out data graphs. And one thing that's really, this is kind of an aside, but one thing that was really interesting and challenging at times was to be able to put out a tweet that was adequately capturing exactly what that graph meant. And so that was a really interesting challenge. I'll explain why in a second. So here's one of those tweets about what the status of library buildings looked like over time. And so this, I want to say one thing here, which is the importance of why we needed to launch the survey when we did. If we had, as I suggested, waited a couple of days, we would have missed this whole point of time when the majority of responses were that libraries were open usual hours. And so you can see how it trends kind of from that being the predominant state to some kind of middle state where some are open modified hours, some are closed altogether, and then it trending towards entirely being closed. And one of the things that was interesting about, tweeting out graphs like this where you don't have a whole long narrative explanation is that, for example, here, the dates that are here are actually when responses were logged and not necessarily when the action was taken from the library. So from a communications perspective, that was really an interesting thing to try to address. There's a lot of other stuff to dig into here, all kinds of tweets. We have our media coverage as that occurred, other tweets that we sent along the way, and then other library data collection efforts. So from public libraries in the US, law libraries, rare book libraries, ARL specifically, and then those outside of the US, so Canada, the UK, Australia, and Europe. If you have something that you're working on that would fit into this kind of category, we are probably not as frequently as we once were, but we are still updating this. There's a dashboard that we added just earlier this week or over the weekend. It is something that is still evolving as the survey evolves, as we continue to get additional requests. So I'm going to head back to our slides here.
Christine, I think you actually went over the fact that there is a category there with all the links to the analysis that we wrote.
Oh, sure. Yeah. So this links out to all of the blog posts that we wrote along the way. The first 24 hours, the next 48 hours, the first 10 days of responses, and then the backstory, which is kind of a version of what this talk has been built out of, about what we've learned about working collaboratively together. Yeah, so I'm going to head back to the slides here. So I've showed you the different kinds of outputs, how we've organized the information, but what I haven't really talked about actually is what we found in the results. And so I'll go over some of the high level findings. As you'll hear in a second, there still is so much more to dig into. So the first is just that the campus practices and policies really waterfall to the library, which is that it wasn't always the case that an institution decided to move instruction online, and at the same time, the libraries decided to close their buildings, and that all services went remote as well. And so there was often a period of time where there was a little bit of a lag in between the first action, the second action. It also wasn't that all of the, if it was a multi-location library system, it wasn't that all of the changes happened at once. There was a certain sequencing of events that happened. So as you saw in the visualization that we tweeted out, libraries moved from being open to partially open to closed actually quite rapidly. There's a really quick pivot to digital reference, digital instruction. Obviously, for many institutions, this was already a part of the service model that just needed to be made a little bit more large scale, more robust. Probably needed to change in some ways, but there was at least some basis for it. And so those really quickly spun up into services in that format. And then by necessity, the remote work policies changed. So the share of libraries that made changes to who could work remotely and how that could be done changed very, very quickly, which makes sense. Most institutions, once the library building was closed, reported no or very limited access to print resources. We know that there still are some libraries that are open in some kind of a limited fashion, but by and large, that became limited very, very quickly. And we didn't see any major changes really, or very many, to tech lending practices. And Lisa and I have talked, and it's entirely possible, for example, that this was a case where the IT office or department took over and started lending out equipment. If the physical library was closed and not circulating anything, it doesn't seem that tech resources were being lent. So in terms of tracking impact, so Lisa and I have we're very fortunate to have a very long Google Doc running of all of the things that we could capture about how impactful this project was. And so we haven't, systematically tracked or analyzed this in any way, but these kinds of testimonials really, kept us going in the first week or two, when I think this was probably most of what we were doing in our free time, and really heard from people about the ways that they were using the results for both advocacy, so trying to move their library in most cases towards closing physical locations, and also for planning purposes, right? So we can't claim that the results in this survey represent best practices, but they are the practices that leaders, you know, across the country were implementing at a certain point in time, so they can at least be used as a benchmark or a set of guiding practices against which one can compare. And then last, we're just going to talk about some next steps and future plans. So I'll start out here and then hand things over to you, Lisa. So got this big question at the top here: how long to collect the data for is the biggest question, honestly, and we've been giving the same kind of line for a while now, which is as long as it's useful. And so it still seems to be useful that we're collecting these data. As Lisa said, the great thing about the instrument is that we are asking for the current status of policies and services at a moment in time. And so it's entirely possible for us to continue using this instrument. We might want to add in a couple of additional questions, but we could continue using this into the fall as institutions start to open back up or change their services within the library at least. So, you know, probably still to be determined on how long to collect, but it's still open. We'll have the URL back up for you in a second if you haven't yet logged a response. So that's something we're still, we still see value in that. So after some period of time of data collection, there's still a number of additional steps that we can take here. As Lisa mentioned, we tried to keep the responses as closed-ended in terms of the options as possible, so we could feed it back out in a live format. But there are many open-ended responses, as you saw in the dashboard, not only in those 2 questions at the end, but also in all kinds of other responses throughout the survey that for many of them probably need to be actually recoded to an existing category and perhaps have just a little bit more detail than what we were asking for. We also can be pulling in all kinds of additional data, and honestly this list, we have two parts listed here. This list could probably go on forever. So we will want to pull in additional data from IPEDS on the sector of the institutions, probably geographical region, a number of other variables certainly that we'll want to pull in to be able to actually disaggregate and stratify by different parts of the sector. We'll also want to gather supplemental data. So a timeline of statements from library associations or perhaps from states that issued mandates related to their library, and to see how the decisions lined up against that and the kind of effect that took place. Lisa, do you want to talk about the last couple here?
Sure. So in addition, I mentioned at the beginning that if you tweet with hashtag COVID library, you end up in a Twitter scraped tweet set. This is not something that Christine nor I had the ability to do at the beginning of this project, nor in the middle of this project did we feel we could learn how to do tweet scraping. But it turns out there's a number of people who do this as a matter of course, and it is an amazing Twitter library community. So a number of people just added the COVID library hashtag into their Twitter scraping thing. So out there are some data sets that we'll be able to draw upon. And a couple of people also grabbed every tweet that was either to or from me or Christine for 10 days. So we can look at the dialogue that the community was having with us as the PIs on this project during those early days, because I know people were giving us advice and asking us to do things. I honestly, it's a little bit like any kind of stress moment. I could not bring those details out of my head right now. So I'm looking forward to actually going back and reading that dialogue. So that's going to be important too for contextualizing the data about sort of an on the ground, what was going on, at least in that conversation. We do want to look systematically about how the survey results were utilized. While we have these anecdotal responses to us on Twitter or through Facebook messaging or any other number of emails, we feel that there's an opportunity here to learn about the ways people use real-time data in decision making. So hopefully we are not going to need real-time data in a pandemic ever again. I feel like I have developed a very niche expertise that I also hope is never necessary, but there are things we could learn from this about what kind of data is useful in real time. You know, did we make a mistake by giving people the option to say other? Should we have just only given closed-ended responses and then made the questions optional if you couldn't answer? Like, did that create confusion or was it helpful? So I have some questions about that that I do think would be helpful in other kinds of real-time decision-making processes. And then I think we also can extract some implications for future crisis response in sort of an organizational response to crisis. Although we don't typically have global crises happening, we do know there are times when, for example, in cases of large natural disasters where entire cities are wiped out, that you're not going to be able to do a pop-up library, or in the cases of a war or some sort of other destruction. And so there are implications here, I think, for organizational crisis response. Including one that we don't have on a slide here, but that I personally am very interested in, that early on we saw libraries reporting, whoever was filling out the survey was reporting that one of the strategies that was being used was regular communication with the staff. Now, I will admit that I was a little surprised at that not being a more utilized strategy, right? Even early on, I thought, surely, I mean, it seems easy, right? Regularly communicate with the staff. But what's interesting is as libraries started to report closing, that strategy started dropping in the percentage of people responding that they were using that strategy. I feel that probably they were getting more emails and the like, but somehow psychologically it didn't feel like regular communication. And so this is me with a hypothesis or a research question here of what is regular communication? Like, what does that mean when we say regularly communicate? I mean, we often hear people say, I wish there was better communication. What does that look like? And what does that particularly look like in crises? And this is like a very fascinating, sort of very small piece in here of people saying that there was a strategy being used that then wasn't being used, and yet our observation is objectively more communication or more messaging was happening. So you have more messaging anecdotally, but you have this other sort of trend in the data that says people were not feeling it, I guess. And so we really, all right, I've gone on too long about that, but I'm just fascinated by that. And I think that has implications for even just regular operations. When we say we have regular communications, do people feel that that's what's happening? So there's so many things that are here. I think the other thing, if I could just say, one of the amazing things about this survey that I take some pride in, I guess I would say with Christina as well. This survey, you know, it's not uncommon to field a survey and have a bunch of people write to you and say they don't understand the questions, or I think we got 3 queries about what did a question mean. So part of it's because it's short and simple and these were very focused. But I think it's also that testing process that we did. But it's really stood up to users taking it in a way, and then people seeming to really understand the results. Though, as Christine said, sometimes when we tweeted out those, like that particular tweet and chart she showed, I think we spent about an hour getting that tweet right, to accurate, not misleading, in 280 characters plus an image. So, all right, I think our next slide say questions and comments. So, oh, and P.S., please continue filling out the survey. Great.
Yeah, so I think we'll leave our contact information up here in case folks have to be somewhere else, but definitely happy to stick around for another, you know, I think we've got some time for questions for a little while.
And I think there are some, so I'll let Diane maybe is gonna question.
Yeah, definitely some questions, and great plug there at the end, Lisa. Keep filling out that survey, folks. And thank you to Lisa and Christine for that great talk. Fascinating, really, to hear about your process, all the things you discovered and uncovered along the way, and undoubtedly will continue to do so as you dig into the data that you've collected and are continuing to collect. Just amazing work. So with that, I will go straight to some of our comments. And I think it's interesting that really what is on people's mind is, where do we go from here? And so the first two comment/questions relate to that. And so I'll read them both back to back because I think they relate. So Boaz writes, first of all, this was very useful. Thank you. And very useful as we are considering how to approach the situation in the coming weeks. And when we hope to begin to reverse the situation, I assume that you will develop a new set of criteria, such as libraries that opened and had to close again, and for what extent of time. It'll be wonderful to have a way to have an accurate read of when such actions occurred and who is responsible for answering the survey. And he notes we had several people possibly answering on our behalf. Also, maybe some ways to reflect on challenges, such as changes to staffing or to library resourcing. Also, I'm particularly curious about the ways by which libraries will address their approach to the wider community outside the campus. And perhaps related to that future looking is a comment from Rebecca, who writes, "This is amazing work. I think it will continue to be incredibly useful, especially as things start opening up slowly and cautiously, to see how libraries are making that transition back and what new policies are in place to protect people, staff, and visitors." And regular, of course, is very subjective. So a lot to think about there. I hope it was okay that I bundled those, but I think they're related.
Yeah, so I think one of the things that, because we designed the survey for retaking, libraries can take the same survey, reporting on these same factors, and their answers will just change from, so for example, my campus went from the libraries are open as regular to we have limited, but we're still open, like some library locations have closed, but not all, to we're completely closed. Mm-hmm. What I understand as our campus intends to do, if you will, a soft reopen. So then I would expect that we'll have a soft reopen in the library. So we'll go back to some are open, but not all, before we ever go back to all are open. And so what will change then, which I think is what is the new set of criteria, it's really the new set of, like the kinds of data people will be interested in us reporting out. Mm-hmm. So when we do say like a 3-month analysis of, first response, middle response to end response, we'll probably see some sort of swing. So it's more in the analysis. So again, it's the instrument itself is actually robust enough to handle reopening.
Mm-hmm. Interesting.
And I guess the other thing that I'll add, yes, it was entirely possible for multiple people from the same institution to be reporting. One thing that's again really nice about the data not being overwritten is that when no changes occurred between multiple steps, we can kind of not ignore them, but we can consider, the first state and the last state of the library, recognizing that things may have been, entered by different individuals. As far as the changes to staffing and resourcing, I think actually would be kind of inappropriate for a survey like this. That's the kind of thing that I imagine we would need to go to, someone in a leadership position to do. So at Ithaka S+R, we're going to be fielding a survey of library directors later this summer into the fall to get at some of those issues that probably those individuals would be the only one positioned to answer from a certain kind of perspective about what ended up being changed. And I'll just say, anecdotally from conversations that we've been having, I think there's still a lot of uncertainty. So to have anyone, speculate now about what that's going to look like, even though, of course there is speculating going on and responsibly, there's all kinds of modeling going on right now. I think there's just still so much work to do and see what enrollment looks like in the fall, what state funding looks like in the fall, all of that.
Mm-hmm. So if I can say, I'm going to share something about something just put out by Christine's organization today, but I put a URL into the chat. Kimberly Lutz and Roger Schoenfeld, apparently, I learned from the summary, have been running some roundtables with library directors at 4-year institutions. And this is a more qualitative summary look at what those discussions sort of say as far as what library leaders are facing, which I think gets a little bit more to the kinds of things that Rebecca was asking about, and kind of reinforces Christine's comment that the kinds of questions we might have for individuals of how are you thinking about these things are not the kinds of things we would collect on a survey about an organization or institution. If I may add, because I've been asked a couple times, like, how did you get IRB so fast for your survey? One thing that's very important is to recognize that the survey Christine and I did was about institutions. And so it is not human subjects research.
Mm-hmm.
When you start asking people, if I were involved in a project where I started asking library directors how they are personally thinking about strategy, that would be considered human subjects research at my institution. And so it would need an IRB. I mean, of course, Ithaka is not a university, so the particular parameters there are different, but as a faculty member, that's something I would have to be really attentive to. So we didn't have a whole lot of things that we would have asked on our survey that were personal, because we weren't asking about the person who was filling it out. We just wanted to know about the library as an organization or an institution.
Sure. Very important distinction. Thanks for bringing that up, Lisa. Very important. Okay, so we've, so Rebecca says, very helpful, thanks. And Boaz also he's very happy to hear that there is going to be this additional survey. So I just want to bring to everyone's attention that we do have the capacity with this tool to unmute attendees. If you would like to make a comment live or ask a question live, just raise your hand and I can turn on your microphone. We're happy to do that. And we have more time for questions. If you want to type them into the Q&A box, I'd be happy to read them aloud. And Lisa and Christine can share their answers with us. And it looks like we have somebody who would like to speak. It looks like it's Boaz. So Boaz, I'm going to unmute you. Okay, you can go ahead and talk now, Boaz. Go ahead.
Hi, Diane, and Lisa and Christine. This is Boaz. I'm the University Librarian here in Lehigh. Very exciting, and thank you for the presentation. I definitely used the data, and as I said, I'm kind of looking forward to learn more about the next steps. So one idea maybe, and that relates to what I think, Lisa, you were saying about real-time data, is to think, how do we mobilize the information in a timely manner? So like, for example, if we knew that there is a crisis happening in a certain area of the world, then we could mobilize library resources and expertise to deal with that crisis. So for example, if there is a regime change and we need to capture internet activities in a certain area, maybe there is a way for us to mobilize our community to address that. There are already pockets of such activities, but I don't think they are coordinated in such a way that really bring all of us to that type of action. So I wondered what you think about it. I mean, you're right. Hopefully pandemics like that are not going to happen quite often, but there will be other things that we can drive the community to do. Thank you.
So I would just say that so I happen to have a colleague here at the University of Illinois in the library, Laila Hussein Mustafa, who has actually, one of her areas of expertise is cultural heritage, protection, recovery, et cetera, in conflict zones. And so there is actually a pretty good community of people that, in particularly in areas of the world that are having, militarized conflict, that look at these issues pretty seriously. I think we have seen also cases like in Puerto Rico, again, one of my colleagues who's now moved to another institution, but Miriam, with Puerto Rico, you know, there was an immediate response from the preservation community because the primary issue that they were dealing with there was the fact that their collections were wet in a very humid tropical environment. And so how were they going to, you know, capture, preserve, clean? So I guess one thing I would say that I think is borne out in the fact that people were looking for this data is that as a community, we tend to turn to each other as a community, and we use existing networks, which I think in part goes to Cliff's opening comment about having, you know, an eye on this from the ARL perspective, but what about these other communities, which is in part why you see that we now have that non-residential dashboard, because that was from the Achieving the Dream, which is a community college organization wanting to understand better what was happening with community colleges. We have the HathiTrust members for that same reason, because there was a desire. So if there were a liberal arts college consortium that wanted a dashboard, that they have a membership list, they just need to get in touch with Christine and I, and we have a way of getting you a spreadsheet where you mark off your members, and then we, by which I mean Christine, codes in your iPad's numbers, and then we push up a dashboard for you. So we just need some sort of organization that's interested in sort of a membership-based approach to that. So we can do that as well.
That's great. Really interesting. Thank you, Boaz, for bringing that up. And I see now that you had written that in the chat. I apologize for not having read that aloud. Interesting.
It's Cliff. I don't see anything else queued right away. So let me ask a question, and I'm not real sure that you can shed a lot of light on this, but I'd love any light you could shed on this. As you probably know, we have, in the preceding couple of weeks, done a series of roundtables on research continuity, looking at how research was kind of shut down and the extent to which it was shut down, and how people are thinking about bringing it back. Now that's a bigger institutional issue than libraries, in the sense that things like physical labs are implicated in here, field work, but it's actually easy to forget the substantial role that libraries play in research continuity in many disciplines. And some of those disciplines aren't fully satisfied by electronic resources that we have available. So in trying to understand that, we asked some questions about how the libraries were supporting that and how they did it at various stages of the process. One of the things we learned was that there are a lot of different definitions of closed. They all basically, you know, have in common closed to the public. But there are some libraries that are closed, but what that actually means is they have a skeleton staff that comes in as necessary to do a little digitization or page a few books for faculty and, you know, graduate PhD students in their last throes of getting their thesis out. So it's actually kind of hard to interpret closed, and particularly what you did where you're trying to really be able to aggregate responses makes it hard to capture that nuance. But as you went through this data collection process and all the communications with people, did you pick up a sense of what closed means to different institutions? And could you share what you learned about that a little bit?
So I think Christine hopefully has seen the message I sent her asking if she would please bring up, because we actually asked more than one question about things being closed, Cliff, for this very reason. And so if we go to the tiny URL website and then look at the survey results, I particularly, yeah, so all libraries, let's do all libraries as submitted, libraries. So yeah, that one, Christine. So the first one that I would have us look at is that we asked about general public access to facilities separate from campus access to facilities, but then specifically we asked about access to print materials, which was Q8. Yes.
Right. So here's, you know, the status of the library being open to the general public, as opposed to us just asking about what you know, the status of the library building being open or not. You said Q11, Lisa?
No, keep going. The one that says the print collection.
Oh yeah, sorry.
Q14. So this is one where we also realize, I mean, really when we say closed and we're talking about access to the collection, we don't necessarily mean is the building open even, because the building could be open and you don't have access to the physical collections. That's even possible. So if we arrow down so we can see the actual responses on this one, not the chart, you can see that we had people indicate like partially as like, could you also get them via delivery, but you could come on site, but it was all staff mediated. It's all staff mediated, but you can't come into the building. It's at a different pickup site, or it's only via delivery, or the final being all access to print materials had been discontinued. So we really tried to push at this a little bit with this question. And so not just assuming that if the building closed, you don't have access to the print collection, and vice versa, that even if the building's open, you would automatically have access to the print collection. Now, in the kind of live dashboards we have here, Cliff, you're only going to see this data, you know, in each question answered. But obviously behind the scenes, we have the ability to cross-tab the status of, say, is the building open with what's happening with the collections access. And of course, we can look at this very same response specifically for ARL libraries. We can look at it specifically for HathiTrust libraries. And so you are absolutely correct that open and closed are actually a lot of different things. And we don't have everything I think you're asking about here, like can you get it scanned or what have you, but we have more than is the building open or closed.
Yeah, and I guess I'll maybe add two things. I mean, I think as you know, Cliff, you mentioned, you know, closed specifically. Lisa, you mentioned open. Like, I think a lot of people are talking now, obviously, about the fall and being open for the fall and what that means. And that carries a lot of different definitions as well about, you know, what the future of the institutions are going to look like. I maybe will also just, you know, selfishly give a little plug to something else that we're working on that Lisa actually ended up providing really good feedback on as a kind of a tester for the development of it is, so my team is working on rolling out, we just announced, yesterday, today is Thursday. We just announced yesterday the availability of a faculty survey that we're offering to institutions. We know that a lot of institutions have probably at this point, you know, touched base with their students to see how they're doing, probably less emphasis on faculty. And Cliff, to your point about what's going on the research end, I don't know that I've seen any instruments really that are covering that. So we have a new instrument that's available now, focusing on institutional communications, faculty as instructors, and faculty as researchers. We know obviously that a lot of research that was intended to be conducted this semester was you know, paused or cut off. We felt that at Ithaka S+R there were a number of studies that we had to suspend or delay until the fall, or perhaps indefinitely at this point. So definitely important to get the, you know, the faculty perspective on what the impact of all of this has been, not just on their teaching, but on their research responsibilities as well.
We did hear at the roundtables a report from one institution, I can't identify the institution, that had done some surveying of their faculty, basically asking how severely has your research been disrupted, and tried to look at the results by discipline. And we really could do with a lot more of that at scale, I think.
Yeah, and to understand exactly what was disrupted,
helpful.
right? If you already had your data collected prior to this period of time, what kind of analysis could you do at home? Do you have the right program on your device? And if you didn't have data collected already, you know, depending on the type of research, probably not much that you could do this semester unless it was related to the pandemic.
Yeah, I mean, one thing that's really clear, though, from their responses and other anecdotal stuff is that it's exceedingly uneven by discipline.
Of course.
You know, there are some disciplines where it's all about lab access. Some, it really isn't. Anyway, we should have a report on that out sometime in May.
Great.
So.
If I can add one other thing, you will notice that, for example, 67 of the first responses here and 61 of the updated responses, people chose other, and then they specified. So there's actually quite a bit of open-ended text here, and I wouldn't be surprised, Cliff. So if you're really interested, you can go to this page, and actually, if Christine arrows down, you can see that you can actually download. It says download legacy CSV. That's a Qualtrics naming thing. It just means you'll get the CSV file of the responses, where you will see people put in things like, oh, we're scanning on demand or something. This is a case where probably for analysis, you would want this coded back up into to a category we had, but people were wanting to share more than what we had in the category. So there might be some things there that you would be interested in, especially on the updated responses, I suspect.
Fascinating. Thank you so much for pointing that out. That really helps a lot. Thank you.
Yeah, thank you. That was really interesting. And I just want to remind everyone that we're still here chatting with you. If any attendees who are still there, we're slightly beyond the end of the webinar time, but if you're still here and you'd like to chat with Christine or Lisa, please raise your hand and I can turn on your microphone. But I think what I'll do now is, again, thank you, Lisa and Christine, for coming to CNI to talk about this really compelling work, which we'll be watching very closely. And thanks to all of our attendees.